You've got the substitute today. Oliver's not around, so as Vice Chair, I am chairing. I apologise. And I'm just going to welcome the Chief Executive of the Council to the meeting. It's always good to welcome to your own building, David.
Very much, yeah.
I've got some housekeeping notices. Fire practice is not expected. If alarm sounds, all leave as quickly as possible by the nearest exit. Assembly point is in the front of the building beyond the fountain. I've got a number of apologies, including Oliver. I'll just put them in the record. We won't bother reading them. A number of people, as you can see, are dialing in remotely. So welcome to all of them. Thank you. Any declarations of interest? I'll take silence to be none. Just a quickie. Microphone system is as elsewhere. You press the red button at the bottom to speak. Press it again when you finish speaking to turn it off. I should have said that as well. Thank you. Minutes of the meeting on the 27th of September. Are they okay? And the action log as well. Anybody want to pick anything up from either the minutes first? No, thank you. The action log. Okay, thank you. Item 4, questions from members of the public. I think we have received one. Andy, do you want to talk us through that, please?
Yes, thank you, Chair. We've had a very late question from Mr. Tim Brown to the board. He's asked a similar question to one he's asked previously around the ICB and ICP commitment to tackling racism in South Yorkshire. So if it's okay with you, Chair, I'll share the response we previously issued.
Can you share that to ICP members as well, please?
Yes, I will do.
Thank you. Okay, item 5, Pathways to Work Commission. We've got Matt O'Neill. Am I ahead of Matt O'Neill? Well, you can talk amongst yourselves if you want and get a cup of tea, because Matt O'Neill is joining us online, and I was told he'd be joining us about 10 to, and I'm a little ahead. Is that right, Mags? Yeah. Okay. So anyone who wants to get a brew, because some of you arrived late, there is a brew over there. I'll wait for Matt, because actually there's a reason for this order, and it makes sense to take it in this order rather than take it. I was told that was right by Stephen. Is that right? So we'll wait a couple of minutes if that's okay. Sorry to those online, but we're going to wait a couple of minutes for Matt to join us. Matt, do I see your presence there? I do.
You do. Good afternoon.
Hiya. Thank you for joining us. Right. I will start. Brief introduction from me, if I may. Firstly, those of you expressing concern for me, and it's not many, I've got a cold. I have COVID tested, just for those of you who are concerned. But if I take the odd throat lozenge, you'll understand. The reason I wanted the order of this is actually we think across South Yorkshire, both in the ICB, I think the local authorities, but certainly the mayoralty, we need to work in a different way in order to think about employment and economic opportunity in a way that drives health inequality. And the three agenda items today are a sense of what we're trying to do, but a sense of how we try and link this together. So that's what we thought was really worth sharing with the full ICP today. Matt, can I hand over to you?
You can. Thank you very much, Chair. So really grateful for this opportunity to speak to you today. So just as a little bit of background, so my name's Matt O'Neill. I'm the Executive Director at Barnsley Metropolitan Borough Council, responsible for all our place-based services, not in the health sense, may I add, in the sort of regeneration, housing planning, neighbourhoods and bins and kind of potholes aspects of place. Within there, I've got a very important service, which is skills. And kind of links into the MCA in respect of the adult education budget and the use thereof. What we've been doing is, over the course of the last 12 months, thinking about how we tackle a very persistent problem within our labour market, and it's as relevant to Barnsley as it is to the rest of South Yorkshire, to indeed it is the rest of the country. And what the idea was to pull together an independent commission with a single line of inquiry to look at how do we enable all of our residents of working age, particularly those currently outside of the labour market, achieve pathways to work. And we view that as an opportunity both in terms of breaking down barriers, but also significantly how we can move forward our economic potential as a region and actually share best practice. So this is a prototype for Barnsley. We're working very much in partnership with the Mayor and the Combined Authority to deliver this. And then we'll be seeking to deliver the learnings across the rest of South Yorkshire and indeed to other parts of the country. So there's a little bit of background. Just jumping through to the next slide, please. When I first sort of dreamed this up, so this was a pre-interview thought that I had when I applied for the job at the council. I kind of put together a dream team of people, and very pleased to say that I've got a number of them actually secured to support us. My vision was always to get Alan Milburn as chair, and sort of to be able to have Torsten Bell, Ben Harrison, Jennifer Dixon, you know, from some of the most respected national institutions relevant to economic inactivity and worklessness, so both from a health perspective and indeed in terms of influencing government policy, but also picking up global expertise, so people who've actually done this across other jurisdictions, be it the European Union, be it internationally, and seeing how we can bring back learning into the borough and into Barnsley. So with that, we've also got one of our own, so Salma Yasmin, so the CEO of the Sheffield Health and Social Care Trust. Exceptionally grateful to Salma. So for on her first day, we managed to get agreement, which I'm most pleased to say, to actually come and share it with us, the launch of the commission. And you know, to actually have that engagement is really important. But also kind of the political dimension. So Oliver, as our mayor, really important that he's involved in leading in terms of his ambitions, both from a health, but also kind of economic inactivity and redressing the balance in terms of good work for our residents. Dan Jarvis, again, sort of Barnsley Central MP, gives us an opportunity to influence national politics. And I think it's important to say, you know, within each of these individuals that we set out, the commission is independent, but also politically agnostic. So the findings from the commission we will be sharing with government, and we're not doing this in a sense of bashing government or seeking to score points. It's actually what are the interventions that are required to move forward this very important agenda, and we'll be making representations in due course once the commission has progressed. We will be seeking to bring together a series of funds that we've got, so both under my control from a local authority, those at a South Yorkshire level, and indeed health budgets that can be used to support individuals who have barriers to employment. And I think just one important distinction I would make, and I believe each of the board will understand this, but Economic inactivity isn't about those who want to work, therefore are job seekers. In effect, these are people who are outside of that and almost hidden from the metrics that we record. So in Barnsley, we have near enough 40,000 people who are currently classed as economically inactive. So there are significant barriers precluding them from working, be it caring responsibilities, be it long-term sickness, be it mental health, be it retirement, or indeed be it kind of being a student. And those factors within themselves present the opportunity for us to address how we can actually look at breaking down the barriers and putting in place new interventions. And the Commission is very much targeted to add that and actually potentially changing the way we do some things. Some of it will work, some of it won't, but we will own that and take it forward. So some of the pilots will be running in parallel in terms of design with the Commission. So just jumping through to the next slide, please. What we've set out is a series of sessions that will bring about evidence and research. So these are private, so we're going to have around about 7 or 8 in total. The first is around launching the Commission, which happened in July the 3rd. We had a second, which is understanding the scope and refining the data. The data, this is key, but it's also very challenging because it's locked under key by DWP and held with very strict regard. To kind of get around that, we've written to the Permanent Secretary and also the Secretary of State and had good conversations through some of our political contacts to Mel Stride, and actually got the DWP to be an advisor to the Commission. So again, going back to that politically agnostic point, we're working with government to look at new solutions and actually seeing how we can use their data to better effect to target residents within the borough and indeed across South Yorkshire. The third session, so that happened last week, and it was great to have Oliver with us for the whole day. And we were learning from successful employment programs, so internationally, that there's some really exciting opportunities to look at in places like Canada, so in Ontario, in New Zealand and Australia, and indeed in other places across the world where this action is actually being put into practice in terms of new ways of working and systems thinking, which is particularly pertinent to our health opportunities that we would like to bring in. We're going to have some other focus sessions, and I'd like to, it'll be my final slide, but kind of open this up, Chair, that we'd really want to engage more formally with health partners to get under the skin of some of the key issues and barriers. We've been lucky in one of the first sessions to hear from GPs, general practitioners in terms of some of the issues they've seen, also some carers and also staff in terms of working in the adult education team and looking at very challenging cohorts. But actually to expand that into a much broader area, but I will come back to that. We also want to have a policy conversation in terms of some of the levers we can pull at a national level, some of the ones we would seek for a further devolution deal coming back through the Mayor, and indeed sort of looking at employers. What do we need to do to facilitate change with employers, and how much of that is kind of the carrot and how much is the stick? And some of those conversations will be challenging, but we need to have them. And those will be over the course of the autumn and into the winter. Just onto the next slide, please. This is the conceptual map in terms of the time frame. So we've got 12 months to do this. We kicked off in earnest in July, and we will be reporting with the outturn full Commission report and recommendations around about the end of June. And as I say, that those will feed into sort of central government, also manifesto development in terms of the major parties, and also kind of key asks of ourselves as a council. So the Commission will report back to Barnsley and Sir Steve, but also in terms of the Mayor, in terms of some recommendations for change. The areas follow those 4 themes, so understanding who's out of work, which is one of the key Chloe's, also understanding who needs help to work and what would underpin that, and then understanding what helps people to work, so the key things that can be done differently. And then finally, it's synthesising all that together into how we build the pathways, the pilots and the programmes. Some of it will be things that have successfully happened in the past, some of it will be totally new, and some things will require complete system changes to the things we like to do. Then there will be myself and my team, so Tom's joined us, who's my head of skills, locked in a dark room to write the report over the course of sort of January through to May, and make sure that that is satisfactory for Alan and the commissioners, that they can get behind it and then report in at the final stages. So just moving on to the last couple here, and then we'll open up for any questions, Chair. What's really important, and we got agreement to this at the last committee meeting, that's a slip of the tongue, commission meeting, which was last Thursday, and this is refining what's in scope and what isn't. So these are the cohorts that I mentioned earlier. we've characterised them with the really useful advice from Torsten Bell in terms of stocks and flows. So your stocks are your fixed cohorts where you've got problematic challenges in terms of moving them in and out of activity. Your flows are the ones that are more frequent and can come in and out at any point and able to catch and bring back in. Now, this isn't to say that we do not value other people that are not characterised, but what we have to do is refine the research programme so we can have maximum impact. And by saying that, we're looking at the areas where there is the largest numbers of those economically inactive, and then thinking how we can work through the programmes. So the massive potential for this and the link to health is you will notice that lots of this falls within economic inactivity for long-term health and disability, and also the aspects in terms of care and responsibility. We've also identified there is massive underrepresentation of female participation in the labour market within Barnsley. So that is a cohort that represents a significant opportunity for us to target. And there is a massive wage divide in terms of monthly and weekly wages that females get to males within Barnsley. So it's something that we're very keen to pursue and support. In terms of the flows, so we've got the opportunity to look at catching people. So we know historically that people outside of the labour market for more than a year are significantly less likely to return. And as you go up to 5 years, it becomes increasingly impossible to get people back in. So we're working with the cohort to describe those that have got ill health and lower skills. And there's a significant number, circa 1,000 people up to kind of level 3 qualified who represent an opportunity to get back in, who will also be targeting. And then those older workers, kind of 50 plus, who are at risk of economic inactivity due to ill health. Now, the other bit to this is the data is quite sketchy. So I've mentioned this in terms of the DWP data set. We're working with a company who've done some stuff for national government called Palantir, who work predominantly in the States to help us create a prototype and pilot for bringing together targeted data at a street by street, house by house data level, so we can actually contact the individuals and link them to the programs that we ultimately create. That for me is quite significant. We can do some of it already, and we have some very useful data within the council, but this would take that to the next level and would be very interesting in terms of policy making potential. The areas that we're recognising that are important but will not be fully addressed through this commission, we will have regard for them but not formally in terms of all the recommendations, is those that are suffering from economic inactivity due to retirement. So prospect of getting them back into the labour market is very low. Those that are studying, so the student cohort within the borough, and then the older workers 50 plus with sustained workers. So this is my key point. We're not ignoring older people, but those who have been inactive for over 5 years, there is statistical data to suggest we will not get those back in. So it's older people, but in the cohorts I mentioned earlier in terms of the focus. And then just moving on to, I think this is the penultimate slide. This is the bit that we would really welcome your support, Chair, is working through the ICP. So a specific session to feed in on health, and we'll share with you the scope for that once I've discussed it with Alan in terms of the areas we would like to look at. Mental health is a massive driver in terms of some of the economic inactivity we're seeing across our larger employers in the borough, and also some of the interventions we can make. So we're really keen to sort of shore that up. And also looking at some of the health interventions from your perspective that have worked in terms of working with individuals to get them back into sustainable employment, and then thinking about some of the necessary steps we would need the private sector to make, because this just isn't about us. We are large employers within the borough and the county, but we need to think about the role for the private sector and some of that pastoral care we would need to apply. My final ask, Chair, if I may, is just what's been really useful, and we've got this from our hospital within Barnsley. If you've undertaken any case studies or employer data with your staff around returning them to work following periods of absence, so from your HR and your occupational health teams, and you're able to share that with us, that would be immensely helpful, because we can feed that in as direct interventions that have worked to get people, catching them before they become out of the labour market, and looking for themes and threads. We've got that from the hospital, we've got that from the council, but if you have some of that you could share, we'd be most grateful. And I'm more than happy now to sort of pass on for any questions, Chair, and my colleague Tom is also happy to support as well. Thank you.
Thank you, Matt. I found that fascinating. Let's see who wants to question. I found that fascinating and really committed for us doing some work with you. So offline, can we think about what we need to do in January and how we do it over what session? But absolutely committed to doing that. And I know Oliver, who chairs this normally, would say the same. Any points or questions? Hi. Would you announce yourself to the...
Sure. Hi everyone, I'm Julianne Hall, Director of Care, Health and Wellbeing at South Yorkshire Housing. Thanks, Matt. My question was, you may have covered this in your presentation indirectly, but how are the people who are currently economically inactive able to feed into the Commission? And the second part is, if we have data on that and we have already done some co-design work, is there a way to feed that in?
That's a great question, Julianne. Thank you, Chair. Yes, so through you, I didn't cover that, so that is an omission. My apologies. The next part over the autumn will it be indeed to undertake qualitative interviews, so with the economically inactive, to get that learned experience and lived experience from residents across the borough. And we will be undertaking a series of structured and unstructured interviews across the patch. We'll be following that up in the new year, and this is something that's quite unique, with some quantitative polling. So we're going to commission a national polling agency to undertake some specific work for us, linked into the research question. And your final point, if you've got data, please share that with us. Within the slide pack, there is an email, which is the Pathways to Work Commission at Barnsley Council. And please send all of that in and the team will gratefully receive it.
Thank you. I've got Angela in Teams. Angela, do you want to ask your question?
Yes, thank you. Councillor Angela Argentin from Sheffield City Council. My question is about how are we going to structure this so that it is like really kind of seamless across the region in terms of access to work, particularly if, people who are inactive are often also can be disabled, and one of the problems is about reassuring employers of how to make adjustments for disabled employees, but it really comes down to cost and how expensive it can be or it isn't, and training. And there are lots of really great voluntary sector and charity organizations that deliver training, but we don't utilize them as well as we could. I'm thinking about training to make those adjustments, for example, for people who are maybe have hearing problems or visual problems or whatever, to be to become more active. People want to be active, but also in terms of the impact on health, the inequalities about distribution of kind of green wealth, if you want, and what impact that has on health, and whether we should really look at the kind of the problem at the at the upstream, rather than trying to kind of resolve the reasons why people might be inactive and then become ill and too ill to work, and I will support that.
Matt, do you want to answer that? Then I've got a few more questions in here. I've got three. Okay.
Thank you, Chair. So, yes, so Angela, what we'll be doing is designing a framework so that this could be applied anywhere in the country. So making cognizance of local factors in terms of labour market and statistics. This won't just be a Barnsley programme that is then applied everywhere. It's almost, these are the tenets of the programme that you need to think about, from finance, from health, from employment programmes to resourcing, that can then be applied in different parts of the UK. And in terms of kind of that cohort you've mentioned in terms of disability, you will have noticed that's one of the big areas that we're looking at in terms of opportunity. And part of the sessions we've had so far have been to listen and hear from the voluntary and community sectors, and to almost set this out as part of that framework that can then be applied elsewhere. I don't know, Tom, if you'd like to add anything to that one.
Sorry, no, to try and turn my mic on, but I think you're absolutely right. I think there is, we discussed this at the day 3, that there's something around de-risking employment, isn't it, for the employee, the potential employee, and also the employer. And I think there's a particular challenge in SMEs about them having the capacity and sometimes the capability to be able to, they may want to do it, but they don't necessarily have the tools to understand reasonable adjustments, to think about that. And I think that was coming through quite strongly, Matt, on day 3, and I think will be reinforced when we speak to employers, and then with your input in terms of the health bit, is that we do need to provide better employment bridges for people, so we can, it's not just about getting people into work, it's helping them stay in work and then preventing them churning out of work as well. And I think we have to recognise that there is a big piece of work we need to do with employers around that notion of good work and healthy work, isn't it, as well? So thank you for that, and it is absolutely a priority for us to look at that.
Thanks, guys. I've got 3 questions. I'm going to ask them to make their points and then come back to you at the end of those 3. So I've got David Crichton, Jason and Greg. David first.
Matt, I'm David Crichton. I'm a Chief Medical Officer at the ICB. I'm also a working GP. For a number of years, we've had the Working Win scheme. So I think there's some evaluation and learning from that you can probably take into this programme. So you're smiling, so you're obviously aware of that. And obviously we'll play our part in trying to connect that GP and wider healthcare voice into the programme. Thank you.
Hi, Jason Page. I'm the Place Medical Director at Rotherham and a GP as well. I think I've got a small concern about the feeling I have from your presentation that people who are inactive for 5 years and over 50 may fall by the wayside. And I just wonder, I appreciate they may be statistically more difficult to deal with in terms of getting those people back to work, but it's pretty much saying if you're over 50 and you've not worked for 5 years, you're never going to work again. And as a 51-year-old, I'm just aware of that a little bit. But I just wonder if there are any plans to engage with that group in particular, even though they're harder. Thank you.
Jason's never a day over 51. So Greg Fell, DPH in Sheffield. So spins on the theme. You sort of give us a sense of there's a lot in this space, and how do you deal with the nuances of the various programs and how people understand it? And then picking up on Jason's question, the sort of give us a bit more on you talked about easy and harder flows. You had a better language for it than that, but easy and hard cohorts. How, in terms of impact, how do you balance the big numbers versus the really, really difficult stuff, which is sort of big individual outcome, but maybe not big population outcome?
Can I pass back to you to pick up those points, Matt, please?
Definitely. Thank you, Chair. So the Working Win, the reason I smiled, David, is we had them in as a key partner to give evidence last Thursday and gave a phenomenal presentation from the team. So Lauren there and kind of from some colleagues. And that is definitely something that we are keen to explore further in terms of best practice and how we utilise that across other parts of the borough that aren't currently accessing it in such a way. So massive potential there. Jason, I absolutely understand what you're saying in terms of the over 50, and I hopefully explained it within my definition. We're not ignoring that cohort. What we're assessing is the reality of the impact we can have, and this links to Greg's point. So we're going to look at the interventions, but they are picked up in other services by other partners predominantly and giving greater weight from other areas. So employment programs might not necessarily be the right thing to do at this moment. There's a part in the continuum where that would be applicable, but it isn't right now in terms of assessing the quantum of impact we can have with the programs, and also looking at where we can actually translate some of this into usable outcomes for residents. There are earlier areas we need to work. None of this is easy, and none of this is kind of going to be straightforward. That particular area has a lot more wrappers and support, and we need to then understand how that fits into the overall continuum. But just to say we're not ignoring it, it's just the focus in terms of response and opportunity from the scope we've agreed is those earlier elements in the over 50. So hopefully that gives you some additional context. Don't know, Tom, if you want to add anything to that bit.
No, not really. Thanks, Matt.
I've got Gavin and then Damien. Gavin.
Yep, thanks, Chair. Matt, that was a fantastic presentation, and I can't help but think it really chimes with some of the other items we've got on the agenda and how we make that connection between health and work. I suppose, Matt, and I may have misunderstood it, but it's just something about understanding the direction of cause and effect. So when I look at the cohorts that you've identified, it's around health being a causative factor in driving economic inactivity. But I'm also interested in the other way around, which is economic inactivity leading to poor health, and that might be something for us to do in the way that we're doing more widely. But it'd be great to kind of read it both ways, if you see what I mean.
I think it's a great point, Gavin, and this is exactly the benefit you'll bring in the session we have in January. And I think Tom's point in terms of the bridge around employers and making that, because Jennifer Hampson said bad work's better than no work. So it's, in terms of getting the right level of employment matters more, and understanding's health role in providing that bridge is essential. So I think you're right, it reads both ways, and I really want to unpack that more in the session that we'll work with the chair and Oliver to co-design.
Damien.
Yeah, thanks. Matt, fully support the Commission's work from Doncaster. Particularly pleased to see Valerie Hannon also on the Commission in terms of looking at the links with the education system and a book on Thrive. Just picking up on the over 50s, some of us are a decade on from that. But there was an interesting article in The Guardian which really got me thinking in terms of workforce breakdown and sort of demography and access around increasingly over 50s wanting part-time work, and indeed people wanting part-time work longer, up to in their 70s, he says, making that case for this decade. And it strikes me that, some of those trends which, we often don't see locally or feel locally, it'd be really interesting, I think, to see those in the scope of the Commission. And a bit of a geeky question, really. You mentioned the systems thinking, you also mentioned Torsten's focus around using stocks and flows. Is there an intention to do some systems dynamics modelling as part of the Commission's baseline in work?
Thank you, Damien. And just for the record, you don't look a day over 50 as well, so I'll just put that one out there. But we are picking up that research, and we've got kind of the paper you reference in The Guardian, so that is something that's within the body of evidence we've received and working through. In terms of kind of the stocks and flows and the scope, and kind of looking that through, we've got quite clear clarity in terms of where we're going to apply that systems thinking. One of the really excellent examples that came out last week was the creation of a designated systems leader in Canada's model in Ontario. So that was an individual who doesn't sit as part of health, doesn't sit as part of the economic development, but his role is to broker the services across different functions. So be it job centre, be it health, be it mental health, be it public health, or be it economic development. And they build capability in localities at a low level and then grow that. And then you grow the team accordingly. And their role is purely about the system delivery and systems thinking across organisations. So that for me was the most prescient example where I could see that applying, both in the context we're talking today, but both in terms of the health and economic potential. So it's a really great question, and something that we're working up in terms of how we can actually apply that for the ultimate delivery model.
Matt, thank you. I don't think I've got any more questions. Dolly, sorry, I didn't see your hand up. Hiya, Dolly.
Hello, thank you. I was just going to speak about the cohorts with the caring responsibilities as regards their capacity and the capabilities that they have as against the resources and the capacity of the employers when it comes to access, and training, and are they willing to take them? So do we have like a sustainable framework that's being used for people in this cohort that we can adopt around? Because this sets that we have a huge number, and it's really and unfortunately, because of the fact that they are carers, as we say, and the family members that they're caring for is already impacted on them. And most of this group actually are extremely inactive and they really want to. So I know with the hybrid working and a lot of things, if there's any sustainable thing that we've done before that we can really adopt around, it will be very, very good. But I see that we need to focus on that group as well. Thank you, Matt.
Thanks, Dolly. Damien, do you want to come? Kate, do you want to come in?
Yeah, sorry. I just wondered how much volunteering had been explored as a bridge into work. I come from a charitable organisation and we very much welcome people back to work via the volunteering route. So I just wondered if that was factored into your bridging into the work and how much you monitored it?
It absolutely is, and to Damien's earlier point, part-time work as well as an entry to that. So nothing is off the table, but we're definitely looking at all the ways that could enable people to have positive experiences in work and then sustain. So yeah, voluntary sector is a big element of this.
Damien.
Yeah, I wasn't going to ask the question, it was just pointed Dolly, but actually that last point has really got one of my sort of hobby horses really, which is the role of intermediate labour, which is slightly different to but a development from volunteering, and particularly because it's place-based and enables economic value to grow and skills to be often reinforced within the place. And Dolly's point about caring, I was thinking around children, young people, particularly nurseries, all of that both increases the parental capability and capacity, but also creates skills that enable them to contribute either to paid employment or indeed setting up small nurseries and businesses. So for me, there's something about the place-based dimension to the Commission that needs to come through as a theme. That's a much more regenerative concept, I think, and yeah, really important point because the barriers to employment undoubtedly are a challenge, and access isn't just to tell you what, let's fill in an application. Otherwise, we wouldn't have all the vacancies that we've got now.
Do you want to add anything, Matt, before we finish?
Just say thank you, Chair, for bringing the opportunity to share the work of the Commission. Really looking forward to working with you. Some excellent points for us to take away. And I think Dolly hit the nail on the head in terms of the care and responsibilities. That is one of the key cohorts that we've identified. And unfortunately, the impact upon females in terms of the borough and missing out on opportunity. So really thank you for the time today to present.
And thank you. I think that's absolutely a core role of the ICPs to think about employment in a broad context, but including health equality. Really interesting. Thank you very much for coming. Look forward to shaping what we do in January with you. Thank you. Thank you, everybody. Thank you for the participation in that. Agenda item 6. Stephen, do you want to introduce this?
Yes, sorry, I will. I wasn't going to, but I thought I might say a couple of things.
Please.
So hopefully you'll see the flow that Pierce alluded to as we move on to this next topic area. So I thought that piece of work is significant really for South Yorkshire as well as for Barnsley, and how we engage with it as an ICP, but how we utilise it in terms of its framework is going to be central. So we wanted to talk about the work of Simca in this context, and Tina, I'm really grateful for Tina coming along and talking about the work of Simca, but she's going to frame the work that we're doing, and she's going to talk through some of the programmes of work, particularly some of the stuff around work in WIN, and which is significant actually, and exemplary. However, what I would say in the context of us thinking about it is not commensurate in terms of the scale or the scope in terms of the ambition that we talked about in this room in terms of the strategy and in lots of other strategies that sit around South Yorkshire. So it is a reflection about celebrating the work and being appreciative of that, but recognising the prompts that come out of Tina's presentation and then subsequently Christine's presentation about, so what is it that we've got to do different and more of in the context of where we currently find ourselves, and where do we draw the learning down from pieces of work such as the work that Matt has so brilliantly presented today. So I'll finish there.
Thank you, Chair. So Tina Slater, Head of Employment and Careers at South Yorkshire Mayoral Combined Authority. I've just got a few slides this afternoon just to obviously, kind of share with you what we've been doing in the employment and health space. But first of all, I just wanted to just give an overview just to, kind of show everybody really where that fits, excuse me, within the wider Simca remit. So could we have the next slide, please? Thank you. So as you're aware, Simca have devolved powers and resources from Westminster, and this is really to enable that local decision making for our economy, transport, skills, housing and infrastructure. And in the context of skills, we can go some way in shaping and developing provision to support our residents and communities of need. We can also have control over the provider base delivering in South Yorkshire, which can also help to deliver more of that place-based provision as well. This also enables us to respond to the economy and its needs, enables us to be more innovative and enhance South Yorkshire's employment, health and skills ecosystem. Next slide, please. Thank you. So since May 2017, the Combined Authority has been contracted by South Yorkshire Integration Board, previously Sheffield CCG, to deliver the health-led employment programme Working Win. So Working Win was one of only 2 national pilots funded by the Work and Health Unit, which, for those that don't know, is a cross-department unit jointly sponsored between the Department for Work and Pensions and Department for Health and Social Care. So during during the trials and the expansion period, the Working Win programme supported over 5,000 people with mild to moderate physical or mental health conditions. And Working Win was initially delivered across South Yorkshire and Bassetlaw, and that was to help people to get into work or to help them to sustain their employment. So when we look at individual placement support in primary care, we know that suitable work is good for our health and well-being, and actually gaining meaningful employment can be a vital part for somebody's recovery journey. So IPSPC builds on the core principles of the fidelity scale that's adopted by the established individual placement and support model. IPSPC is delivered in the community healthcare settings, and it's applying a modified version of the 8 key principles that you can see on the screen, and that's integrated into an individual's normal health treatment plan, and it encourages recognition of employment as a driver for their health and well-being. So for the Working Win programme, excuse me, it's not a mandated programme. Individuals who come onto the programme come onto it voluntarily, but they must want to gain employment at the end of it or sustain the employment that they are in. The Working Win programme has had national evaluation and local evaluation. We know that IPS works. Evidence shows excuse me, that clients who have accessed IPS were twice as likely to gain employment compared to traditional approach programmes, and also those individuals also gained work through IPS. They also kept their jobs for longer, earned more money, and it also helped to reduce the need for NHS services. Another, I suppose, a key factor with this, though, is that when we look at those 8 key principles highlighted, it's really important that that model is followed to high fidelity. So it's not about kind of taking core bits from there, it's about applying those in the full principle. Next slide, please. So throughout last year and this year, we've been working closely with our ICB, local authority and DWP colleagues, and have successfully secured additional funding to continue Working Win in South Yorkshire. So for this current contract, for example, it doesn't include Bassetlaw, it is purely a South Yorkshire programme. And in the spring budget this year, you may be aware that government announced a new programme to be rolled out across the country from autumn 24, and that is universal support. So the universal support programme is intended to build on the health-led trials and the expansion programmes. So the current IPSPC programme in South Yorkshire, Working Win, along with delivery from 11 other combined authority areas, are now being seen as phase 1 to that universal support offer. We've had our fair share of senior visits as well. We had Secretary of State come to see Working Win in action last month, and also a couple of months previously we've also had directors from the department come to actually see it work in real life, and what they want to do is really learn from us and help, you know, kind of the learning that they get will help to inform how the national universal support will be shaped. We're continuing to work really collaboratively with our ICB colleagues, strengthening relationships between both of the organisations, and not really just in Working Win, but certainly across all kind of my function areas within SIMCA. So, for example, apprenticeships, the work we're doing in schools, the work we're doing for carers. It's actually a really exciting time. So I think when we look at what next, we absolutely need to build on those successes from Working Win, and the Pathways to Work programme as well as a good example of that, and we were able to share that last week. I've spoke about universal support, so phase 2. So I'm meeting weekly with DWP officials to make sure that what we've learned in South Yorkshire again is being fed into that. There's the Work Well programme as well, which government have also announced. I don't know if many of you are aware of that. There's not much information that's trickled through, other than that we know that there's a spec. It will be a competitive bid for combined authorities, but that needs to be a joint approach with ICB, so they really need to be integrated together. The spec for that is expected out in autumn this year. We're also in the early stages of undertaking a mapping exercise, and that's really to understand the landscape of employment provision available to residents, providers and business across the South Yorkshire region. And again, working closely with LA, DWP and ICB partners who have all contributed to this so far, we're starting to build that. And the aim really is to identify those gaps or duplications in existing provision, as well as surface any of those best practices that can be shared more widely. And that will allow for a more coordinated and optimised employment services across the region. So over the coming months, our plans are to really finalise that mapping exercise and do some analysis to create a user-friendly interface that can be updated regularly. We plan to host a series of localised provider events in each of the 4 local authority areas, and that would be to review our findings, discuss programme coordination and align on pathway development. We'd also like to explore launching a joint provider event across employment, health and skills sectors to facilitate that cross-disciplinary collaboration. And then also, I think, kind of a bit of a long-term vision is to really develop a clear programme of pathways for South Yorkshire based on the mapping that really residents, providers and businesses can access. So that work will enable a more coordinated, transparent access to services for residents and employers, and I think it's a really important step for us in enhancing South Yorkshire's employment, health and skills ecosystem through that improved alignment, partnerships and access. Could we have the next slide, please? So really, in terms of how ICP partners can support, we know that the Working Win model is a model of excellence for us in South Yorkshire, and it is really important that we do build on that. But how can we work better together to support employment and health? And that's a question that I'm keen for us all to maybe have a discussion about. But just some of the suggestions from me to share would be, I spoke briefly about the Work Well bid for South Yorkshire. I'd be really keen to collaborate even further on this and make sure that we put a solid bid in for South Yorkshire, because there are only, they are pilot areas. Informally on this, we have expressed our interest to DWP that we're keen for us to be part of that. But then also, when I spoke about the employment and health mapping exercise, it'd be really good to get some additional insight from partners to help inform that further as well. Thank you, Chair.
Tina, that was great, and I think natural follow-on from the first conversation, so that was great. Any questions? David? If the light's not on, it's not. Have we pressed the red button at the bottom?
Yeah, that's it. Yeah, thank you, Tina, for a fantastic presentation. I totally agree with you that Working to Win is a wonderful opportunity. It's worked well in Rotherham, totally supportive of it. But up to this moment, it's been sort of been done not from any work we've been doing with the Health and Wellbeing Board or through ICP, etc. It is, as you say, a Simca plan, partnership strategy, and you did refer in general terms to joint opportunities with the ICB, continue to work with the ICP, continue to develop in partnership. But because this is a Simca project, I just think I'd like more clarity about what that actually means in practice. And yes, you say to work together, more than happy to work together because this is a very good programme, but it needs more detail about how that governance structure, how it will work with SIMCA and ICP.
So it's a very good question, and if I'm honest, I haven't got the answer for that, and I think that's, you know, kind of some of the next steps that we'd really like to explore, actually, how we can make that work. In terms of us working closely with some of the ICB colleagues, we've been working with Christine and her team as well around looking at a pre-pilot programme that we'd put to DWP that would see a hyperlocal approach in South Yorkshire. So that's some of the closer working that we've not necessarily done before, and appreciate, yes, Working Win is a SIMCA programme. It is integrated in primary care, and we've got some really good relationships with some of the primary care networks, but I think it's just building on that further, and I think the next stage discussions would be how do we take it to that next stage and actually have that joint approach and application. Is that okay?
Thanks, Tina. Greg.
Cool, thanks Tina. Dead helpful. So take as read broad support with caveats on the how and all that kind of stuff, but take as read. 3 quick questions or comments. How good and robust is the system convener role? I was conscious Matt made a point about having a system convener, someone that is the banger of heads together and all that kind of stuff. How robust does that work? Second, the data evaluation point. I suppose we all need to take care about slaving over data. We know NHS data, the really interesting stuff is in primary care. We know that's hard. We know DWP data is hard, particularly the benefits data, where all the big win from an HMT perspective is. We should go there, but it's hard. So I'd give some thought to it. And then slightly off-piste from this, but welcome some thought to this in the future, is what are the focal points for the good work, fair work kind of agenda? What are the focal points for sort of Hockey health and safety at work, which does a lot of the heavy lifting to keep people well? And how do we tie it all together, I guess? No easy answers to those.
Thanks, Greg, for that. So in terms of just the kind of the last point actually that you were talking on in terms of the focal point around good work and fair work and occupy, I think there's quite a bit that we still need to do in that space. And again, we have spoke with Christine and a team, and I know Ruth, you've been involved in some of those conversations as well, haven't you, around actually what else can we do in this space? I think, you know, when we look at in the community around that occupational health support, a lot of it is around focuses on what you can't do, and actually we need to look at what you can do. So that's, I think, something that we'd be keen to explore further. Would you mind just repeating the first and second questions again? Sorry, I know the second one was on the data evaluation.
The middle one was how much are we going to slave over data that's really hard to get hold of and join together at personal level, and the top one was how robust is the system convener, system leadership role in all of this?
Okay, so I think we're still in a place where we are really shaping that convener role, and again we're really keen to work with partners to shape how that looks really, Greg. And I think in terms of that data evaluation, yes, we do need to take some from, you know, the evaluations that have took place, but it's working with local authorities and ICB colleagues at the tools that we've got to make sure that actually what the local data tells us, our programmes respond to those needs.
Thanks, Tina. Sorry, I missed you before.
Thank you. I always get beaten by microphones. So I'm going to go in the opposite direction to Greg, and one of the points that I wanted to make was about data, but particularly insight, and taking that insight to a community level, but also just kind of thinking about what they're doing in Barnsley, the work that Matt's described, and how important it is to understand people in context. And I think that's a really key part of understanding how you move people to a point where they can start to engage in positive activities. And there's an awful lot of community embedded support that brings a whole range of support around people that I think it's really important to consider in this work. I think it's also important to consider in that the factors like the importance of shared relationship, agency, social capital. And so thinking about it from that South Yorkshire level, I think it's good to understand where the opportunities are, but I do think we need to be building upwards from a community level to really think about who do we care about and how do we actually, in quite a granular way, how do we get to support them differently?
Yeah, absolutely. Thank you very much. And I think at some of the the local provider events that I mentioned, I think it'd be good to include things like that, you know, kind of within that to gather that information. Thank you.
I've got Mariana online. Hi, Mariana.
Afternoon, thanks, Piers. It was great to hear both the presentations this afternoon. I was just really thinking about a reflection around both focus, don't they, on those people that we know with kind of physical, mental health, long-term conditions, those people that need support to come into the workplace. And I was just wondering a little bit about thinking about, you know, the kind of links with things like research and development, innovation, you know, the increasing number of players that we've got in that space, particularly around health and care, and the opportunity we have at the other end of the spectrum, thinking about economic potential and the kind of how we in South Yorkshire support and develop those kind of highly skilled specialist health and care type jobs that come along with those kind of partners. So I just didn't want us to forget in terms of thinking about, you know, our future economic potential, the, you know, the link with the kind of research, development and innovation agenda.
Thanks, Mariana. Dolly, you wanted to raise a point.
Thank you very much, Pace. Yeah, I was just wondering about the question Tina put across, which was about how to work together to support employment and health, which got me thinking a bit. And I just felt we need to know what's on ground at the moment. If we have data about the findings, and then to be able to know the gaps within, and that's when we'll be able to say, because there's a lot of things, including what Mariana said. If we look at it, I was thinking about employment and employment, and then I thought about safe space and a couple of things to identify the needs of our current workforce, you know, and I think we could get that more if we go more with to try to speak to people with lived experiences to find out, and that's where we can know the gaps, what we're doing already, what that can still be done, and compare. I got thinking because I'm not sure of the data and how far. I know a lot of work has been put into this. I don't know what we have on ground, so it would be good to have access to that so that we can have a good read and know what's the gaps that we have and see what more can be done.
Dolly, thank you. Can I ask Stephen to finish up? Stephen?
Yeah, thank you. I mean, that was a really helpful discussion. What I said at the start was actually, again, put my thanks on the table to Tina for coming to present today, because actually I think the work that she's talking about has been significant for South Yorkshire, and there are similar pieces of work that have taken place in other regions as well. The evidence that emerges out of those pieces of work, which have tended to emerge out of devolution deals, is that those sorts of models, place-based, is Greg going to come in on me? All right. Right. Okay. Well, I'll filibuster him out then if you want. Relational, place-based relational models that tie back into the stuff that Damien talked about in terms of intermediate labour market solutions, they deliver significantly better outcomes than the top-down transactional models that we've all experienced. The issue is that actually the stuff that Tina's talking about is but a sliver of the employment ecosystem. And therefore, we've got to reflect upon the emerging learning that's going to come out of pieces of work like Matt's work that tells us, well, we need to be thinking in a much broader sense of in terms of where we want to get to, but we also need to reflect upon the fact that we will not have our hands on all the levers in terms of wanting to affect some of the changes that we want to affect, and that will be a significant conversation I suspect we're going to want to come back to. Right, I shall hand over to Greg now.
It's not a question, it's an observation, it's a quick one. Folk often tell me, oh, but there's nothing going on around the determinants of health. You've just heard two really, really, really good examples. The challenge for us all is better, but we should have a positive narrative that there's a whole bunch of amazing stuff going on around what folk call the determinants of health. There, I was quick.
Thank you, Greg. A good way to finish that conversation. Tina, that was great. Stephen, thank you for introducing it. And the third agenda item on workforce in its broader sense and what we can do is on supporting our health and care workforce, anchor institutions. Christine, are you leading us into this? Okay, grand.
So thank you, Chair, and I'm really pleased to be following those two presentations with this proposition and presentation just to describe it. So, I mean, you've talked a lot around work and health, but this is about largely how we take a mindset shift and view our entire workforce that we've described in our bold ambition in our integrated care strategy as population. So they're largely our population. So I'll hand to Ruth.
Ruth.
Thanks, Christine. So for those of you who don't know me, my name is Ruth Spear. I'm a consultant in public health and I work within the MCA, but actually also across the ICB. So I'm kind of joint funded post. And work and health is obviously really in that space between the two organisations where I think we could be doing a lot more and building on the great stuff that's happening at place and actually adding value at that system level. We all know this, employment's key determinant of health. As Gavin said, this is a kind of circle. So if you're in work, your health is likely to be better, and if your health is poor, then you fall out of work. So it's kind of a supporting kind of structure around that work and health. And it's got to be good work, it's got to be quality work, so, pay, conditions, the ability to progress, etc., etc. And we know that good employee health is good for the economy. They're both sides of the same coin. We know that a lot of our productivity gap is due to our poor population health. So it's clearly an area where health and economic development sort of come together. And we know that economic inactivity is rising across the country, but also in South Yorkshire, and of particular concern is this is happening in younger age groups as well, so it's not just older people. So if we can now move on, and then obviously, as Christina has said, that our health and care workforce, and actually if we think about it even broader for the whole public sector, is a large proportion of our population. So if we can help them to stay healthy and stay in work, then we are also impacting on our population health outcomes. Sorry, next slide, thank you. So Christine and I and other colleagues have been trying to sort of think in the space of what's the anchor institution role. And I know a lot of anchor institutions across South Yorkshire, not just in the public sector, but voluntary sector anchors are already doing a lot of work in this space. So I think that there's kind of three areas that we kind of thought were kind of in that anchor institution frame. There's one around what are we doing around procurement and social value to support good work opportunities across South Yorkshire. And then also, what are we doing to increase the accessibility to good work? And the way we recruit, is that actually getting to people in communities? Are we providing those pathways to work that actually work for people? And also, how are we making sure that our workplaces are really inclusive and diverse and welcoming and actually flexible enough to allow more and more people to actually take up those employment opportunities? And then the other area is actually what are we doing to reduce the level of economic inactivity due to poor health? So what are we doing with our workforces to keep them well? And if they become unwell, how are we supporting them to stay in work, even if it's not necessarily in that role? How flexible are we being around the edges on that? I've had personal experience of this. I was a doctor in the NHS. I became unwell with a long-term condition, which meant that my job was no longer suitable for me. But I wasn't supported into another job, another avenue. It was, I had to kind of find my way out of that. So I think this is happening a lot within our workforce. And actually, we could do this better, couldn't we, collectively? So how are we doing that collectively? Next slide, please. Thank you. I just tried to I'm kind of like graphs and pictures and infographics and things like that. So I just tried to kind of, I suppose, pull this together. So what are we doing around good work opportunities? So how are we increasing the availability of good work? Accessibility to good work? Just reflecting on some of those earlier conversations. We always talk about demand, don't we, in terms of what employers and businesses want. Well, actually, what do people want in a job? And we're seeing this in younger people, that they don't want to work long hours necessarily. They want that work-life balance. People want to be more flexible, part-time. How are we actually kind of supporting those different ways of working? So how are we supporting people into work, and how are we supporting people to stay in work? And what are we doing to create workplaces that actually support well-being? So if I can hand over to you, Christine, I shall.
Thank you, Ruth. And I didn't introduce myself, but I'm the Chief People Officer at the Integrated Care Board. So if we could just move to the next slide. I think it's what we're wanting to show here is we have a bold ambition around valuing and recognising our entire health and care workforce, paid and unpaid. So we've been spending quite a lot of time to try and describe that entire workforce, and that's a challenge in itself. So this is emergent, so please bear with. So at the moment, that is where we've got to in terms of making up our entire workforce. So you can see we have adult social care, personal assistance, paid voluntary sector workforce, NHS employed, we've got contingent labour in terms of bank and agency in the NHS, we've got students who are doing health and care roles, we've got primary care, we've got volunteers, unpaid carers. Now, I'm pretty sure we haven't finished this yet, but already we are on over 300,000 people who will largely be South Yorkshire residents. Obviously, we know that's not entirely the case, but largely. So what I think our approach to this as an integrated care partnership provides us with an opportunity to potentially think differently around that entire workforce. And so with thanks and apologies to Barbara Coyle, because this is very emergent visual, and I'm sure Barbara will want us to work on this a lot. Can we move to the next slide, please? So 320,000 is the size of a large city, perhaps roughly the size of Doncaster. So if you were mayor of Doncaster or the council leader for Doncaster, sorry, Damien. How would we view the population health of this city, which is our entire workforce? And at the moment, we have really great, in the health and care, we have really great generic health and wellbeing offers. We have occupational health services. We've got a developing roadmap around that, but it's fairly generically available. And it's not often used by all of that entire workforce, even though it's potentially available. But what could we do if we actually targeted our investment a little bit more specifically? If we know, for example, that 16% of that entire workforce is going to have long-term conditions and probably more than one long-term condition. If 60% of that workforce are going to be obese, you know, if 12,000 of those people are going to be living with cancer. So, and we know in the NHS workforce alone, 40% are unpaid carers as well, adding on to that. So there's a whole different set of dynamics that we could play in to understand the potential health needs of the workforce. And I think it potentially affords us an opportunity to think differently about how we might target our health and wellbeing investment with the aim of keeping those people in work. That's 320,000 people already with a role in health and care, whether it's paid or unpaid, who will be positively impacting on the health of the wider population to that. The more we can keep those people well, to be able to carry on doing those roles will have a positive impact on population health generally. That's our premise. So the opportunity, I think, if we could move on to the next slide, please. The opportunity, I think, of having this bold ambition as an integrated care partnership is we've got our employer responsibilities, but also our anchor responsibilities. So what could we actually do differently to try and support our population to be as healthy as they can? So if we took a population health approach to our workforce and use that mindset shift to think about it differently, could we target better? So that's one question. Could we better support health and wellbeing and take actions to prevent ill health and improve support for those with long-term health conditions or disabilities and enable people to continue to thrive? So I do think there is a potential here around the prevention activity work that we could potentially target more at that 300,000+ group. And if we did, as Ruth gave you a personal example of, perhaps take a more asset-based mindset, a more flexible approach to ill health and disability, a mindset to supporting attendance rather than managing absence, which as employers we largely are in the latter area. But to do that, we'll have to draw on our collective resources as employers in South Yorkshire, because sometimes a small organisation or even a big organisation can't continue to employ somebody because of the nature of their business. But if we focus on what can they do between us as anchor employers, we might actually be able to find and support somebody into another role. And I think that conversation could be really quite powerful with somebody. So those are the questions that we're seeking to try and explore in a bit more detail. We do have another graphic, which if we could just bring up. Ruth, do you want to describe this actually?
Yeah, sorry, this was just a little bit to kind of have some ideas about what that might look like. And I think Christine has kind of covered some of that, but actually what are we doing to support health screening or target health checks or workplace health clinic? What are we doing actually within the workplace environment to actually support people to access preventative measures or actually support them to be healthier in the first place? And that's just a kind of idea of where that might sit. So I'll just move on if that's all right. So next slide.
So thank you, Ruth. So just to finish, what we'd really like to have is hear your thoughts on this proposition. What do you think really investing in work and health might actually look like in reality? How could we collaborate more effectively as anchor employers to support a healthier workforce? If we add in the whole public sector, that's a significant number. And what I would argue is what joins us with all employers is we all want our workforce to be as healthy as possible. So actually, I think there's a commonality here that could be a conversation across any industry. And on that basis, there potentially is potential for collaboration with other industries in terms of investment into this area. So there is a paper to go with this. We just wanted to go through this presentation really to summarise that. So there's a bit more detail in that point, but I'd be really keen to understand your thoughts and feelings on this.
Christine, Ruth, thank you. I've got Greg, David, Nicholas, thanks. Greg.
Cheers, both. Dead helpful. I'm so glad you didn't call it a public health approach too. Well done. So really interesting. I'd never not thought about it as the size of a population of Doncaster, etc. Very, very interesting. So prevention programs largely exist. They're all under-resourced, all that kind of stuff, but they largely exist, and they're rightly focused on whole populations rather than the population employed by any particular sector of the economy and all that kind of stuff. That bit does need some thought. Needs some thought on approach. So it's dead easy to do mental health first aid training but not address toxic bullying or fair pay, fair work, all that kind of stuff. So just give a bit of thought to that, and I'm more than happy to help in this practically as well. Inequality, focus on pay, low pay, etc. Those with least, etc. And lastly, and I'll say this with an eminent professor of gerontology in the room, you didn't mention ageing, and it's the sort of the second, third, fourth careers, reskilling people so that they're able to stay in health-enhancing work for longer. And we don't do a right good job on that anywhere in the country, to my knowledge, unless Prof tells me differently.
David.
I totally agree with Greg's point, looking at my age, about helping people in older areas carry on more seriously. The ideas expressed do link well to Rotherham's local priorities, which are already fairly well developed, and I'll come back to that in a second. But I think that in terms of the discussion topics, perhaps you need to go back one stage, because what isn't coming through is the work which local place have been doing, and I do know that an awful lot of work has been doing there. So, for example, Rotherham does have a place anchor institution action plan, which we've had for well over a year, which has its aims reducing inequalities by employing more people from deprived communities and from other inclusion groups, focusing on retention, progression, inclusivity, and supporting the health and well-being and quality of life of our workforce. So we agree with what you're trying to do, but what we're saying is that a lot of work is already done there already. You're talking about going to employers. A lot of that work's been already done at local place level. A couple of other things. I mean, don't get me wrong, I totally support the health population angle, totally and absolutely, and working together. I think you may need to think about a health needs analysis of the whole population, which didn't come through very well. And I think also another area is looking at local recruitment inequalities. Damien mentioned how difficult it is at the moment to recruit staff. Well, I'm sure we're all finding that a case, and that really should also be part of our plans. I think those are key points I want to say.
Thank you, Nicholas.
I'm Nick Mapstone. I'm the Vice Chair at Barnsley Hospital. Just a couple of observations, if I may. I mean, it's a staggering figure that 2/3 of the population are overweight or obese. And there's one organisation that I've visited as a CQC inspector, which is Dartford and Gravesend, and they've done some really excellent work in targeting the problem of obesity and people being overweight within their workforce. Really well worth going to have a visit to them, I would suggest. And also there's some brilliant work that's been done by the Yorkshire and Humber Academic Health Science Network on blood pressure monitoring, which is something that you didn't put up on your slide there, but you know, if you put that along with obesity and smoking, those are the three things that we really need to target. And then I appreciate that we didn't talk much about procurement in the presentation, but clearly as an anchor institution, there's much that we can do by targeting as much procurement activity into the South Yorkshire community. And if you look at the numbers at Barnsley Hospital, only a tiny, tiny proportion of our procurement spend is actually spent in the area. So that's something to have a look at. Thank you.
I've got Dolly first and then Sharon. Dolly.
Thank you very much. I was thinking about our entrepreneurs and self-employed in our workforce, and I'm not sure whether I missed out or maybe there's a work that's been done on this group or kind of cohort and we have access to as regards their employment and inequalities as well, because they stand a very high chance of developing a lot of health issues, especially because I'm just thinking, do we have access to resources that these people or this group have a resort to? Because from the look of things, from the little I've seen, I'm not sure if I've come across any work being done on this group regards our workforce. So I was just wondering, mine is more of a question than a contribution to all that we've said. Thank you.
Thank you, Dolly. Sharon and then Alan.
Just really good to see this piece of work and really supportive. I think there's some good stuff in there. I do think we should challenge ourselves about the real living wage. As a country, we say that to exist, the real living wage is what you need to exist on. And I know that challenges us as employers because obviously money is tight. But if we were really going to do something that made a difference to people's lived experience and their opportunities, we would all be paying a living wage or have plans to aspire to pay it. So I know it's hard, I know it's difficult given our finances, but if we're really serious and bold, then actually we would all be prioritising making sure that everyone, all our contracts, direct employees, those people that work and subcontracts for us, actually got enough money that the country says you need to actually live on. So I'd really encourage us to kind of grapple with that. Maybe we might need some words that give people the opportunity to get there over a period of time, all the sensible stuff. But I really think that we've really got to put in there about aspiring to achieve the real living wage.
Sharon, thank you. A really well made point. Alan.
Thank you very much. So Alan Walker, Chair of the Health Equity Advisory Panel. There's a whole lot going on in this space and much of it is complementary. I'm very pleased to say Ruth will know already that we have a major goal that's being set within the plan that will produce eventually around employment, and that is the goal that everyone in South Yorkshire of working age works in an organisation that is classified as a fair employer that promotes health and well-being. And we've got a string of recommendations to support that. And I might say that those recommendations have been largely drafted by colleagues in the private sector, Dave Capper from Westfield and Richard Stubbs. So that, you know, there isn't a simple public-private divide. So this is complementary, and our focus is largely on the nature of work and the organisation of work, whereas some of the previous presentations have been about pathways to work, enabling people into work. But we have to also focus on the nature of work itself, which brings me to the difficult question of terminology. Good work is incredibly difficult to define. So when I wrote the Sheffield Fair Employer Charter back in 2013, I used the term fair employment because it's easier to approach, and we can do it from an equalities perspective largely. But defining good and bad employment is very difficult indeed. So we just need to be a bit careful. And actually, we need to align the terminology that we're using in different parts of the region so that we're all saying the same things with the same words, if you like. But absolutely wonderful presentation. Thank you.
Alan, thank you. I think what we've got real support for this. I think the challenge, as ever, I think, for the ICP is to say, this is great, what do we need to do next to make a difference? And in a sense, I think we need to pick that up outside, but I think it is something about coming back and saying, here's some thoughts we've got on making a difference, because I think that's the challenge. So really, really good work, but actually the next step is, and what are we going to do with it, and how do we make a difference? So that was really good, Christine. Thank you very much. Really helpful. Okay, there is agenda item, the ICP operational group. Short report, Will. It's not a paper, it's just a report, isn't it? Yeah.
It is just a report. If it's all right, please, I've just got just a couple of things to update, if that's okay. I will be brief. And just a reminder, really, we set up the Integrated Care Partnership Operational Group during the development of our Integrated Care Strategy, and of course, the focus of that group's been refreshed, and now it's really on trying to support bringing to life the strategy. So partly is about just sort of saying thanks to the group. So part of the work has been really about thinking about what kind of discussions we need to bring to the ICP partnership. So we remember back in May, we talked about children and young people, we had creative cultures, and now we're work and health. So really trying to bring out some of those bold ambitions within that strategy. That's been a key focus, really. The group also has been really thinking about how it supports the wider working of the ICP as well. It's not a decision-making group. It's really about just trying to sort of get some of the work going. So a really big focus on that. Couple of things that I just wanted to just take a minute just to update on is how we start to really align some of our existing focus that we've got of our people around that. You're seeing that here today, how we're bringing through some fantastic conversations and also some of the work that we're already on with, but also trying to align some of our existing leadership around that. Previously, we discussed an approach where we would take a distributed leadership approach, and therefore I just wanted just to the ICP to know that actually that's really starting to come together, so we will be able to share with you a proposition around what that distributed leadership looks like around some of these big themes. So we'll do that next time, if that's okay, Chair. And also around the joint commitments. So in our strategy, we set out some really important joint commitments. They're things that we found really important in being big enablers to enable us to really move some things on. Part of that is around shifting the focus. Part of that is around shifting resources. Part of that is around actually doing things quite differently and quite creatively. So we'll have a proposition around how we might be able to take that forward. One of the things that we've also been doing, because there aren't, obviously, there isn't a pot of money that sits with the ICP that's separate. There isn't a pot of resources. We're making the best use of the resources that we've got. And you'll know that previously we talked about how we might focus some resources on enabling us to keep this work going and really starting to bring it to life. And I think we've landed on an approach that really builds on that how do we harness the work that's already happening, and therefore how do we bring to bear our people and our resources that's already in that space. So I just wanted just to reflect that. I think that's the approach that we're taking there, and I think that's been really helpful discussion that's been led by colleagues across South Yorkshire, and particularly from our DPHs, who I know a couple are in the room as well today. I think the sort of final thing on that is just thinking about how we start to sort of support the ICP to frame its agenda going forward as well. So I think we've kind of allowed the agenda to evolve based on the good work that's happening, which I think is working quite well. But I think where we get into so collectively is a proposition about how we might be able to support a more forward-looking agenda for the ICP. So we'll talk about that next time if that's helpful.
And then we've got to note the health. I don't like HEAP. Is it just me who doesn't like HEAP? It's David. I'm sorry.
Just briefly, I'm pleased to hear Will's report there. I'm fairly confident that the operation group now is moving in the right direction, particularly in terms of its links and its relationships with this group. So just to say, thank you, and also I'm pleased that the communication in terms of what the ICP operation group is doing is now being fed through. So well done, thank you.
Health Equity Advisory Panel. Is there anything to note on that? Oh, hi, Alan.
Okay. There are some slides. If someone can put them up. If not, they're in your papers. So, Chair, you asked us at the last meeting for a further update on the work of the Health Equity Advisory Panel, HEAP. Apologies.
It might just be me, Alan.
No, it's me as well. Is it possible those slides can go?
Yeah, I'm just between this.
Yeah? Okay. Yeah, no, it's okay. I know what they are. I just want everyone else to see them. Never thoughtful.
I know. It's very slides.
Yeah, absolutely fine. Yes. Okay. And Stephen has helpfully brought his computer. Okay. So very quickly then, Chair. The first slide shows terms of reference that were agreed with Oliver. And of course, the main focus is around his ambition for health in this region. And you can see, if you can look at those terms of reference, that they are highly action-oriented. And there's a reference also to a hierarchy of recommendations, and they speak to the different roles of the mayor. So there are some things that are in the power of the MCA. There are some things that perhaps his leadership could bring into action, and there are some things that lie completely outside of the scope of the region, and that requires advocacy to national government to bring about change. But if we want to achieve the core ambition of the mayor, we can't do that unless we bring in action from national government. I think that's very clear. The next slide shows the membership. There are 20 members. I am responsible for the membership of the panel and tried to select very widely across all relevant stakeholders, but trying to keep it manageable as well. Next slide shows progress. And you can see that we've made significant progress so far. We first met in March and have met monthly since then. And as I reported last time to this board, a really, I think, striking and remarkable feature of what's been done by the panel is the level of consensus. So you have, on the one hand, a very wide range of stakeholders, and on the other hand, a huge terrain of potential recommendations that will influence health and well-being in South Yorkshire. But there is really remarkable consensus across those stakeholders, those panel members, about what are the core. Yes, there we are. No, let's not go back. If you go on, next one. No, back. Back. So, okay, you can see, next one. You can see the progress there. We've agreed the essential principle, the approach we're taking. We've agreed 10 long-term aspirations, goals for South Yorkshire. We've nearly finished drafting the recommendations, and we're drafting what we call key enablers. Next one, please. And you can see on that list of essentials, obviously I'm not going to run through them, but we are talking about bold ambition, a radical paradigm shift, emphasis on health and well-being as rights, life course approach, strong focus on social commercial determinants of health, and so on. Next one, please. And as I say, we have framed the future health and well-being of South Yorkshire in the form of 10 core aspirations. There are 3 of them as examples here. Be born safely and in good health, live in communities that are inclusive, empowered, resilient and safe, and so on and so on. And I've already mentioned that there is one framed around employment, fair employment. And each aspiration is supported by a narrative, why this is crucial, what the ICP strategy and health and well-being board say about it, and what more is required. Those are our recommendations. And you might say, well, where have they come from? And shouldn't those aspirations be national aspirations? And I would reply, yes, they should be, but they aren't. They are in Scotland, in Northern Ireland, and in Wales, not in England. So we have had to draw on those goals from the 3 devolved nations and construct our own. So if they're accepted in the end, this region will be the first to establish broad, far-reaching, long-term goals to achieve health and well-being. Next one, please. So we are currently finalising our recommendations. We are not a commission. We are very thinly supported. The University of Sheffield has put a small amount of money into this project to provide some research assistance, but it means we've had to rely on the work that's been done already. And I don't think that's necessarily a bad thing. We don't want to constantly keep reinventing the wheel. But the recommendations come from Manchester, the Midlands, and from London. And they're currently being cross-examined by specific topic experts according to those criteria. Next one, please. And then we're finishing the framing of what we call the enablers. So if we want to achieve those aspirations, there are certain structural changes that are necessary in order to gear up to and create the conditions in which those aspirations can be met. And those are the sorts of things we're talking about. Health in everything. Inclusive economy, data, changing our institutions. We've heard a lot about that already. And capacity and capability, obviously crucial. Next one, please. And then finally, Chair, what we need to do to wrap this up, finalise those recommendations, agree the enablers section of the plan. We've got examples of good practice from all 4 authorities. They just need to be edited so they can be put in boxes in the plan. We need also a statistical overview, which is largely done, and then present the draft to the mayor. Hopefully by early next year, if we're lucky. The only other thing to say, Chair, is that we're holding a listening event in early November for those seldom heard groups across South Yorkshire, largely black and minoritized ethnic community members, in order to literally, and the mayor will be there, to listen to their perspectives on this agenda. Thank you.
Alan, thank you. Really helpful. I was going to ask you about the timeline, so thank you for any points for Alan. Yes, thank you. So it goes to the mayor in turn of the year. Clearly, we'll need to think about pulling it here, Steve, but we can do that outside the meeting. Alan, thank you for that. No more questions. I don't think I've got any concluding remarks. Thank you all for your attendance today. Date of the next meeting, the 30th of November, and I hope you've got a real chair by then. Thank you. See you.